Good morning. Our health department provides a core service as far as assuring that every child and every adult can have access to critical preventive measures that they need or preventive services that they need in order to have a healthy life. And our department works somewhat as a safety net, so we do provide most of those services to the underserved populations, whether that be uninsured or underinsured. Our childhood immunization clinic provides greater than 30,000 shots in a year, which amounts to over $1 million. And we're the second largest provider in the state of Missouri, which kind of led us to our problem. It's twofold, actually. First, you take a look and you'll see that the majority of the kids come in during the month of August. And the reason for that is that it's required by schools to get the copy of the child's shot record in order for them to enroll. Well, the problem that adds for our department and our staff is that it's just an enormous amount of tremendous resources and time additionally that we have to find in order to accommodate for this extreme rush. Also, during that time when the child comes in, the parents may not know what point they are at with their immunization status. So they may stand in line for 2 to 3 hours just to find out that all their child needed was a shot record. So we partnered with the Code for America to help us walk through this process and hopefully extend out that rush and help us serve the patient more efficiently.
So when we met Tiffany and the rest of the team at the health department, we realized something really quickly. The delivery of healthcare is inherently a human process. There was no big tool that we were going to build that was going to take the place of the dedicated work of the nurses and registration clerks in the health department. And so we actually had to start with the people and figure out where it was along their process that we could help them at every step of the way. So the first thing that we did was actually get all of those people into a room. And we invited the nurses, we invited the registration clerks, we invited the department directors in a room for a journey mapping exercise, which meant that we literally printed out a 10-foot-long map of every step that happens from the moment that someone steps into the health department doors until the moment that they're actually receiving a vaccine from a nurse. And then we asked them one central question. Where are the bottlenecks? Where does this get hard? And this exercise led to the creation of a document that had all of those steps centralized, along with the pain points that came out of them.
And as we've already just heard this morning, government is a very slow process. When I first saw this document, I was amazed. I was like, this is so logical. Why haven't we done this process before? We've had these employees that sit maybe 300 feet away from each other, and we've never sat down and ironed out the entire process. And what this actually gave us was an idea of additional, bottlenecks and things that we hadn't even considered before.
And the great news was, as part of that process, we all agreed on the first place to start. And it was that moment of triage, when someone first walks into the health department with their child and says, does my child just need a shot record to enroll in school, just a printed out copy? Or do I actually need to wait for a shot? And right now, as Tiffany mentioned, both of those audiences are waiting sometimes for hours. We thought we could do better. So we created an application called RecCheck. RecCheck actually pulls in CDC requirements and matches them against a patient's vaccine record. And this allows a layperson, like a registration clerk, to tell when someone's up to date on their shots, saving several families many, many hours that they otherwise would have been waiting to see a nurse. But that's not all we figured out. We realized as we were designing this that we could actually help the nurses at one more step, and that's when they're reading shot records. The nurses currently are doing a tremendous amount of mental math for every shot record that they're looking at. They're calculating using cheat sheets, often on their fingers, when someone's born, when they got their last vaccine, and how much time has elapsed. Great news. Computers are great at math. And so we were actually able to surface that information right away and redesign the record to bring it to the forefront. But even with all the technology we could build, the fact of the matter was we still need to get people into the health department to begin with. And this is the kind of stuff we would hear all the time because people are so busy, often working multiple jobs. And so we needed to come up with a way to reach parents and trigger them to come in, not just in August, but also at other times of the year to rebalance the load. So we started a text message reminder recall program. Over the course of the fellowship, we sent over 10,000 pilot text messages. And through this, we realized it was a great way to reach people where they're at. people who often don't have internet access, people who often change addresses, and it's also a really affordable way for the health department to be able to do this outreach. In the past, they hadn't been able to afford often to send mailings home or to actually do reminder calls. With text messages, this became affordable, and it also saved time. Jelena, the head nurse at the health department, told us this moves a process that took them weeks to aggregate addresses into a process that takes minutes to push a button. But all of the technology kind of pales under this big question, which is that we're going to go away soon, sadly, and we're going to leave the department. And so from the beginning, we wanted to ask them this question: what is it that you need to help sustain this work? And when we asked that question, they didn't say we need another shiny piece of technology, and they didn't say we need help with procurement. What they told us was we need to build the capacity of our department so that it can carry on this work even after you leave. The capacity of people like many of you. So before we left, we partnered with the city's Office of Performance Management to create Data Academy, which is a monthly series of workshops on how to use and make decisions based on data. At this point, we've actually trained close to 50 employees from over 14 different city departments. It started while we were there, but it's going to continue long after we're gone.
So about a year ago, I was sitting out there in the audience like you, and in the blink of an eye, this fellowship program that we've partnered with Code for America has come to almost a close. So we are struggling with how are we going to keep that momentum moving forward? How are we going to make these changes and continue with this path? And so I am thrilled to announce that, and not the only one apparently, that we are creating a digital services team at the health department. We are going to be hiring a product, thank you. We're going to be hiring a product manager and a lead coder to come in and help us move that journey forward. So it sounds like we'll be competing a little bit with Philadelphia and Boston maybe. So I thought maybe we'll bring out some barbecue or something. So but thank you very much.